Sponsored by Community Psychiatric Centers and is produced for educational purposes only. It is not intended as a substitute for medical or psychological advice, diagnosis, or treatment. The content should not be used for self-diagnosis or treatment of any health-related condition. As always, seek the advice of your healthcare provider with any questions regarding a medical or mental health condition.
Good evening and welcome to Community Psychiatric Centers Presents All About Autism. Tonight we're going to focus on medication that's used to treat autism, and we'll find out how that medication is being used in conjunction with other types of treatment. To help us, we're joined again this evening by two experts in the field. Dr. John Carasso is Clinical Director of Community Psychiatric Centers. He's a clinical licensed child psychologist and a certified school psychologist. And Dr. Robert Lowenstein is Medical Director of Community Psychiatric Centers. He is a board-certified child, adolescent, and adult psychiatrist and a fellow of the American Academy of Child and Adolescent Psychiatry. Good evening again, doctors.
Good evening. Thank you.
Dr. Lowenstein, let's begin with you tonight. How exactly are these medications used to treat autism?
Well, the treatment of autism with medications targets two types of problems that children with autistic spectrum have. One of them are the core symptoms of autism, which we've discussed before. They include problems with communication, problems with socialization, and problems with the need for repetitive behaviors and impaired interests, which are quite restrictive. The medications that we use in psychiatry in the treatment of autism don't do a lot in addressing these symptoms. They do some. Usually, however, psychiatrists treat what's called the target symptoms of autism, which are other symptoms sometimes associated with other conditions that children with autism may be diagnosed with or have.
Give me some examples of that.
Well, problems with overactivity, inattention, aggression, self-injurious behaviors, severe anxiety, obsessive-compulsive concerns, depression, all can be targeted by the use of medications. And we can discuss which ones help which symptoms.
All right, Dr. Carasso, Dr. Lowenstein mentioned that medications can help other types of treatment. Can you give us some examples of that?
Well, the treatment process targets the core symptoms in terms of, for example, communication problems and socialization. The difficulty, though, is with the target symptoms interfering. For example, if a child is inattentive or combative or tantrumatic, then it's very difficult to move forward. So the medication can help a child, for example, to be more attentive. If we can increase the extent to which a child is attentive, they can learn more and they can move forward. Also, in terms of safety issues, for example, if a child is self-injurious or combative, the medication can help to alleviate that as well, which can be very helpful.
Dr. Lowenstein, can you tell us more about which medications seem to work for which problems?
Right. The first class of medications that we use in the treatment of autistic type symptoms, target symptoms we talk about, is a class of medications called antipsychotic medications or neuroleptic medications. They are used, there's one specific medication that has just been approved by the FDA in the treatment of autism. It's called risperidone. It's an antipsychotic which targets mostly the aggression, temper tantruming, self-injurious behaviors, and problems sometimes with overactivity. The medication, while approved by the FDA for this use, can have some side effects, which can include increased weight gain, problems with sedation, problems with feeling dizzy, and it's very necessary for children to be tested for increased fasting blood sugar levels, increased lipid profiles, cholesterol being too high, and this is done on a routine basis.
Dr. Carasso, would you say that risperidone has helped in the treatment of some of the children
Sure.
that you're dealing with?
Yeah, what we tend to find is that Risperdal helps the child to feel calmer, more at ease. This helps the treatment process. It helps to relieve the family. Also, it helps the child to feel more in control of their behavior, their emotions.
Yeah. Also, the behavioral interventions are the best interventions that we have in treating autism. And if a child is out of control and severely tantrumatic or severely aggressive, they can't really be engaged in the process of treatment unless they're calmed down.
All right, we're going to take a short break. We will be back with more questions for our doctors right after this. You're watching Community Psychiatric Centers Presents All About Autism on PCNC. Stay with us.
Every parent has sweet dreams for their baby, but what happens when the unexpected happens? When a child develops slowly, has trouble talking, or withdraws into a world all by himself? Today in America, an estimated 1 in every 150 children is diagnosed with autism. And while there is no known cause and no known cure, an early diagnosis can make a major difference in an autistic child's life. At Community Psychiatric Centers, Dr. John Carasso and Dr. Robert Lowenstein have more than 50 combined years of experience diagnosing and treating many thousands of children and adolescents with autism spectrum disorders. They, along with their highly trained professional and caring staff, can evaluate, diagnose, and treat children and adolescents who may be having problems at home, in the community, or at school. If you believe your child needs help, call 1-877-899-6500 for an evaluation at one of our 11 convenient locations in southwestern Pennsylvania. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
And welcome back to Community Psychiatric Centers Presents All About Autism. Dr. Lowenstein, let's talk a little bit more about medications that may help children who have autism or autism spectrum disorder.
The next class of medications that we often use in the treatment of autism are the stimulant medications. Children with autism spectrum disorders often present with overactivity, inattention, impulsivity, which interferes with their ability to function both in treatment and at home. So we use the stimulants in that regard to target those symptoms. There are two types of stimulants. One are the amphetamine-based compounds and the other are the Ritalin-based compounds. There was one study that showed just recently that Ritalin was able to reduce inattention and hyperactivity by almost 50% of the population that were treated in a double-blind study. So that's a pretty good result to get. Children on these stimulants can become increasingly moody and somewhat irritable, so we have to watch the dosing of that medication.
I always thought that was interesting that children that were hyperactive you give stimulants to. I mean,
Yes.
to a layperson it sounds like that's a little confusing, but why does that work?
It is counterintuitive, but that's the way the brain works in these children. It helps to reduce what's going on in the brain, basically, and to try to regulate the brain chemistry.
Dr. Carasso, how are the anxiety and those obsessive-compulsive symptoms helped by this medication?
Well, interestingly, obsessive ruminations and compulsive behaviors are one of the primary barriers to treatment. If a child is involved in an obsessive focusing on topics, if they are compulsively involved in their rituals, then it's really a challenge for staff, and it impedes the child's socialization. And medication can help to alleviate that, not remove it, but alleviate it, so that we can move forward in the treatment process.
So instead of a child just continuing to repeat and repeat and repeat, it kind of blocks that a little?
Well, what it does is it helps us to more easily redirect the behavior so that we can move on to something more productive.
Dr. Lowenstein, I also noticed that mood stabilizers were on the list along with some other medications.
Right.
What about those?
Well, the antidepressants that are on the list are those medications that are used to treat the target symptoms of anxiety, depression, and some of the obsessional and compulsive symptoms that you were just talking about. The mood stabilizers, such as the anticonvulsants, are used to also target impulsivity, aggression, and the mood irritability symptoms that these children can face.
Let's talk a little bit now about biomedical and complementary interventions. Let's Dr. Lowenstein, tell us a little bit more about them. I understand they even include some vitamins.
Yes, the complementary interventions can include a bunch of vitamins that have been tried. These are anecdotal studies. They're not proven, and they're certainly not FDA approved. But there are good reports out there, and there have been, that some of the vitamins, such as the vitamin B6 or the methyl 12 vitamins, seem to help in reducing the autistic symptoms in children. Some of the reports, though, also indicate that while the help starts out pretty good, in the end, it doesn't help anymore. And clearly, this is still under study.
And now we also have omega-3 fatty acids.
Right,
Is
you're
that
talking
it?
about the fish oil.
Right, which most people would be, unless you have a child that you know is autistic, people might wonder, how does fish oil work? How do these things work?
Well, I don't think anyone exactly knows how it works, but the anecdotal studies do indicate that it has helped some of the symptoms of autism as well over a period of time.
And the dietary component can be very important, and I know we're going to have a guest on in our next segment to talk about that, but what are some of the special diets?
Right, well, there are the casein-free diet and the gluten-free diets, which are quite helpful. Again, the diets are quite difficult to use, and we have an expert who's going to talk about that. The theory behind it is that certain children with autism and without cannot tolerate some foods that they may ingest. They'd include these two, as well as dairy products or some other foods which they can't tolerate, and it's caused by what's called a leaky gut syndrome, which means they can't absorb the food properly.
And what happens, Dr. Crosso, when the children eat these foods that contribute to their problems?
Well, we'll talk more about that in the next segment, of course, but one of the things that parents report is it creates increased agitation, social skills decrease, self-awareness, and environmental awareness decreases as well, according to the reports.
All right, we're going to take a short break. We'll be back with a very special guest right after this who can fill us in on these special diets, and she's even written a few cookbooks. So we'll be interested to meet her in just a few minutes. You're watching Community Psychiatric Centers Presents All About Autism on PCNC.
As a parent, you want your child to reach his or her full potential. For children with autism, early detection and treatment can make a world of difference in your child's life. At Community Psychiatric Centers, our autism unit is led by two highly trained and experienced mental health professionals, Dr. Robert Lowenstein and Dr. John Carasso. Their expertise in the field of autism spectrum disorders means you and your child will get individualized help you need every step of the way. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
A special early bird edition of the Just Pay Half Sale starts April 24th at 6 a.m. Buy bargain certificates for half price, including certificates from Alexander's Athletic Clubs, Pittsburgh's premier health and fitness centers with 5 convenient locations, Augie's Roadhouse, hit the road for good times and great food, Century Inn, located less than an hour from downtown. We make every event memorable. Howard Johnson Hotels, go anywhere, stay here. And Penn Monroe, good food, good people, great prices for over 40 years. Go to WPXI.com April 24th at 6 a.m. while supplies last.
And welcome back to Community Psychiatric Centers Presents All About Autism. Before the break, we were telling you that there are special diets that can be of some use in treating autism. And right now joining us is really an expert in the field. Her name is Lori Karavolis, and Lori is a registered nurse. She's better known as Lori Bakes, who has a great deal of personal and professional experience in the dietary field. Lori, I know you have 4 children, 3 of whom follow what's called a GFCF diet. Your home is a certified GFCF bakery. You regularly conduct seminars on the topic, and you've written 2 cookbooks. So welcome to the show, Lori.
Thank you.
Tell us more about this special diet and your experience with it.
The diet, to explain the diet, the theory behind it, helping an autistic child, would be that casein is the protein found in milk. Gluten is a protein found in wheat, rye, barley, and oats, mostly because of contamination. Those several proteins affect a certain subset of children that are unable to break those proteins down. therefore affecting the brain. They are unable to digest those proteins, and therefore leading to a lot of signs and symptoms that you see with some of the autistic children, such as decrease in socialization, communication. If the proteins are not there, by leading a gluten-free, casein-free diet, then therefore the problem, the child feels better with gastrointestinal issues resolved, therefore leading to more positive behavior.
This can be a really significant problem for children that a lot of
Correct.
parents might not realize otherwise.
Correct.
Your experience,
Right. I have 3 children on the diet alone. My first son is actually allergic to glutens, so he's a little different situation, but I do have a daughter on the autistic spectrum, and she's been on the diet now for 3 years, and we've seen very good positive results with the diet.
all right, Dr. Crosso, what does the available research show as to whether these special diets really work?
Well, when we speak with parents, we get almost invariably a positive response. The vast majority say that it helps their child to be more attentive, more aware of their environment. However, when we take a look at the research, it's largely what's referred to as anecdotal, which would refer to a person's personal experience as opposed to a double-blind study that Dr. Lowenstein mentioned prior. So the challenge with survey research, and in fact there's a survey that was out that indicated, it was back in 2005, took a look at over 23,000 parents, and 65% of which indicated there was a positive response. But again, when we're looking at surveys and anecdotal research, those types of research are vulnerable to errors. For example, there's a time frame between when the diet commences and when the effects surface. Well, let's say that during that interim, a child starts a new school, a new treatment process is commenced, the child matures. Well, how do we know if it was the treatment, how do we know if it was the diet or these other factors that contribute to it?
It's also called the placebo effect.
That's true.
Just going on a program, special treatment, has a certain placebo effect in practically all interventions.
Now, having said that, though, the significant positive response that Lori will speak to of this diet and the parents' strong support of it is really compelling and really suggests that it's worth considering.
Yeah.
Lori, how do we know if a child actually needs to be on this diet? What do you look for?
There's really no official test that can tell if the diet is going to work or is not going to work. Some of the testing that's out there, there is a urinary peptide test that there are sometimes false errors. It's not 100% reliable. What happens, the basis of that test is if the child is not digesting the proteins well enough, they will spill out into the urine, knowing that the child is having problems. But because the test is not reliable, the best thing to do is to try the diet. Give it a 3 to 6 month period, a true try. If the child responds, then that's the best indicator if the diet will work.
All right, Dr. Lowenstein, tell me more about testing.
Well, there is some testing. There's IgG testing done for the antibodies to the casein or gluten in a child's body, but that's not necessarily going to give you the answer as to whether or not the diet is going to work or not work, or whether a child is allergic to those particular substances. You have to try it to see.
In the general population, isn't there a bigger concern about trying gluten-free diets? I mean, just in the general population, people are kind of moving toward that.
It seems.
Yes.
It does seem to be the case.
Yes.
I had mentioned prior about the time frames. I was wondering, in terms of the time frame from the time that you start the diet and when the diet starts to take effect. I wonder if you could speak more about that.
Yes, usually we say to give the diet at least a 3 to 6 month period, and the reason being is gluten can stay in the body up to a 6 month period, and casein up to a month. Some children, it may take that long to get distributed through the body, and the diet then would be able to be seen if it is going to work. Some children actually take up to a year to see if it's going to work, in fact.
Can you tell us a little bit about how difficult it is to implement this diet?
It is difficult, especially at first, and I like to say it's almost like riding a horse. Nothing is easy at first. You get on, and there's times when you're going to fall off. There's going to be times where you have to go slow. So at first it is a little overwhelming, but I also like to tell people that there's definitely resources. There's much more availability of information and foods now, especially because of the increased celiac population. the labeling laws that were instituted in 2004. So actually, a diet now is I should say a little easier now than it was years ago.
Well, speaking of that, if you could speak about the specific foods that need to be avoided, and then the replacement foods that you would use, and then in terms of shopping, is it difficult to shop for these foods?
The foods that would be avoided would be anything with wheat, rye, barley, and oats, and of course any type of milk product. The labeling would be one thing to look for as far as shopping. There are substitutes for just about anything that you would want. Instead of milk, there's a soy milk, there's rice milk, there's nut milk. So there's many options for that. Replacements for butter, of course. And as far as the wheat products, you could buy them pre-made, whereas I usually do. I make a lot of things at home.
How do you make them tasty?
It's been a lot of experience, a lot of trial and error. I've been baking this way for about 8 years, and I threw a lot of bread out prior to getting a tasty loaf. But once I've accomplished that, there are recipes and there's ways to go ahead and taste, make the product taste as better, as well as, or if not better, than other foods.
How do you go about getting a child, who's growing up in the fast food generation to go along with the diet? I mean, can they ever go into the restaurants where they're getting blitzed all the time about, try this hamburger, try that?
Right. I like to talk of it more of a lifestyle than a diet. Not only do 3 of my children follow it, but we basically all follow the diet. So there's 6 people in my home. My husband and I and my oldest daughter do not have to follow the diet, but we feel it's actually a healthier lifestyle, and with decreased processed foods and fast foods, there are items that are able to be bought at the fast food restaurants that they can still consume.
All right. Lori Caravolas, Lori Bakes, thanks so much for being with us. If you want to find out more about the dietary side of autism treatment, you can log on to cpcwecare.com, and you can find a link for Lori's website, which is loribakes.com. And when we come back, we'll have more information on diets, and we'll answer an email question. You're watching Community Psychiatric Centers Presents on PCNC.
As a parent, you want what's best for your child, and that can mean asking for help if your child has problems at home, in the community, or at school. At Community Psychiatric Centers, our highly trained professional staff offers mental health diagnosis, treatment, and therapy to your child in their natural environment, at home, at school, in the community, or at one of our 11 southwestern Pennsylvania locations. One phone call can change a life. Community Psychiatric Centers, connecting you, your community, your world, one family at a time.
At 10 o'clock, it's a fast-paced newscast.
Live, local, late breaking.
Police just told me about this.
Straightforward news, the news you want.
A frantic search.
The pilot did make a distress call. Everything you need to know from the day, we've got for you at 10 o'clock.
And local weather.
People want to know out there, what is the weather story every day?
And it's from the Channel 11 News team.
You're busy and you're going to bed early?
That's why we have that show. Channel 11 News on Fox 53 at 10.
Welcome back to Community Psychiatric Centers Presents All About Autism. And we've been talking this half hour with Dr. John Carasso and Dr. Robert Lowenstein of Community Psychiatric Centers about medication and a lot of different types of treatment interventions for autism. And Lori Caravolas was joining us in the previous segment. These are the cookbooks we were talking about, and during the break I got to really thumb through here, and there are some really interesting dishes that you can create for your children. Some I was very surprised, because you think of gluten-free as not really exciting when you first hear it, but I'll tell you what, there are peanut butter banana chocolate chip muffins, there are pancakes, apple fritters, everything from pumpkin rice pudding. There's some great stuff in here, so take a look. You can go onto cpcwecare.com, get a link to Lori's website. Welcome back, doctors. We were talking about the diet, the gluten-free, casein-free diet, but what about a lot of the others? Dr. Lowenstein?
There are quite a lot of other diets out there. One is the Feingold diet, the other one is the Candida diet, and there are others, and those are out there for those people that wish to investigate them, they can also link it to our website for the information.
A lot of different things out there. A lot of people really have to kind of be directed to all these different things because it can be
It is.
a
Overwhelming
maze.
at times. There's also a theory that adding various enzymes to the diet can help with the digestion process. It's also very common for parents to try removing various items such as sugars and soy with the hope of getting a positive response from that.
And also milk products and dairy products.
Yeah, as we mentioned.
So there's no real quick fix. There's really a lot of trial and error depending on the individual child and what works.
Well, sure. The quick part is especially relevant given that, as Lori mentioned, it can take months before we begin to see an effect, especially with removal of the wheat products. That really is a challenge. It really is.
And it's important to add one new thing at a time so that you know what helps. If you add too many things at one time, then you have no idea where you are.
Yes.
All right, let's turn to the email right now. We have an email question. Will all the medication that we've been talking about, the different types, will medication change my child's personality? I think that is a huge question for parents.
No, the use of medication does not change personality. What it does is it targets certain symptoms that you want to correct. So, for example, if a child is hyperactive or aggressive or self-injurious, you want to correct that by using some of these medications. The personality itself is not changed unless they develop a side effect to one of the medications, in which case their personality looks like it's changing if they become more irritable or withdrawn.
How closely do these medications have to be monitored? Because we've seen those black box warnings that are added. I mean, how much follow-up needs to be done and how often?
You definitely need to follow these very closely, especially the antidepressants where there's a black box warning for suicide and some of the others. So you really do need to be closely monitored.
Sure. And speaking of the issue of personality change, I mean, what we've found is actually just the opposite, that a child's personality can be enhanced. Keeping in mind that if a child is struggling with being hyperactive, inattentive, agitated, combative, tantrumatic, it's very difficult for them to be their pleasant self. And so if the medication can control those symptoms, then we find that their personality blossoms.
How much improvement have you seen when you get that right combination? What does it mean for the child and for their family?
Some children improve dramatically, and we see great improvement, and other times the improvement is slower and not quite as dramatic. All treatments, as we've talked before, require intensive interventions, 20 to 30 hours a week of discrete trials interventions. Lots of help from parents in trying to implement some of these interventions as well.
We would never dream of using just one. We wouldn't dream of just using medication or just the behavioral treatments. We would try to use a combination as needed.
All right, doctors, thank you again so much for being with us. Very interesting. And of course, if you have any questions at all about any of the topics that we cover on this program, you can go to the website cpcwecare.com and you'll get an answer to any of your questions. And we want to thank you for being with us this evening. We will see you again next week on Community Psychiatric Centers Presents All About Autism. Good night.